Kids, tonight we're going to talk about the Great Medicare Debate of 2012. This is very, very important. It's going to be kind of a wonky discussion, but everyone should be having it because it affects everyone. It affects everyone in this country. There is no one that is not affected by this somehow. So here goes. Our politicians on both sides of the aisle are attempting, once they get past the screaming soundbite, emotional, meaningless stage, there actually is a substantive discussion about what to do with Medicare. Now, many people don't even realize what Medicare is because they've heard things about it, but they've never really been involved in it. So, from kind of an inside perspective, let me explain the basics of Medicare. Medicare is a government set up program like an insurance that takes care of the elderly. It takes care of the disabled if they've been disabled more than 2 years, and it takes care of people with end-stage renal failure. And that at any time happens immediately if you find yourself in end-stage renal failure or kidney failure, for those of you who don't know, people that require dialysis. It's very expensive. So those are the three things that Medicare takes care of. It does so through the private sector. It is not a government-run operation done through government doctors and government clinics. That is not how Medicare works. Medicare is like an insurance company, and you go out to your own private doctors of your choice, and you get services, and they pay 80%, and you pay 20%. That's how it works. It's an 80-20 proposition. They have A, which is like big stuff like hospital stays. They have B, Plan B, which is like your regular care. And then they have C, which is Medicare Advantage, and we'll get to that in a second. And then they have Part D, which George Bush II put into place, George W. Bush. Medicare Part D is the prescription drug program. And that's relatively new. It happened in the early 2000s. Now, when they added on Medicare Part D, the government did nothing to fund it. So it's costing hundreds of millions, if not billions of dollars for all these prescription drugs. And it's a very good program, but it just never got funded. There was never a tax added on or any way to actually put money in Medicare to pay for this wonderful thing. The other part of Medicare Part D, which most people don't know unless they're in it, is that there's a huge, what they call, donut hole, which means Medicare helps pay prescription drugs up to $2,000 per year, but then from $2,000 per year to $5,000 per year pays nothing, and then after $5,000 it kicks in again. So that's what they call the donut hole. And it's a killer for a lot of elderly people because $3,000 is a huge amount of money when the average Social Security and disability recipient is only getting about $12,000 a year from the government. That is the average. So yes, it's very difficult. So if you're only bringing in $12,000 a year, and at the cost of groceries and housing, etc., doctor's appointments, transportation, now you're having to pay, and you're having to pay from that your your Medicare copayment through what's taken out of your Social Security check. Then on top of that, if you have gap insurance, you have to pay that out of your Social Security check. There's really very little left to eat and live on. So it's not a glamorous lifestyle. No one's having Cadillacs and lakefront houses that are relying on Social Security and Medicare for life. It's just not the case. Now, there are wealthy people that are getting both Social Security and Medicare, and they're entitled to it like everyone else. But the average Joe, this is their retirement. This is all they get left. That and maybe a couple of grand, but that's not a lot. So, especially if you've never purchased a house, being on Medicare and Social Security is very difficult if you have to pay rent. Unless, of course, you're entitled to Medicaid and they can put you in a nursing home. Whole different subject, though. So that's Medicare. Now, We've heard a lot of these emotional discussions about Medicare and the $716 billion in cuts that Obama supposedly is putting in place to pay for Obamacare. Now, that's all we hear. We don't hear what those are. We don't hear who came up with them. We don't hear anything about it. And then we hear Republicans kind of program. They seem to be vague on it, but those $716 billion are in their program too. Cuts to Medicare. Now, where are those cuts coming from? Primarily, they're coming from Medicare Advantage. And Medicare Advantage was a test program they put into place. See, Medicare was designed because private insurance would no longer insure seniors because they were too risky and they were paying out money and they weren't making any. So they dropped all these seniors, and then they would live in abject poverty and die grueling deaths, usually in state-run old folks' homes, or they'd just be abandoned by their families in small apartments or whatever, left to die. And no one had any money to pay for them. So they lived in poorhouses run by the state. And way back in the day, Ronald Reagan said, we could do better than this. So they started closing all those institutions. And he cajoled, and others cajoled, private insurance to try to get into the Medicare market. So they said, well, we'll pay you a premium over what Medicare pays by itself to do like an HMO kind of thing. In other words, to mind these people that sign up for your program and go through gatekeepers, etc. A primary doctor is called a gatekeeper in an HMO. And their job is to filter out when somebody goes to a specialist and all those kind of things. So they shovel them through doctors as gatekeepers, and their goal is to make their healthy outcomes increase and the cost decrease, because the less cost it is for them, the more of this profit they get to keep. So private insurance set up these different programs called Medicare Advantage. And the advantage to having Medicare Advantage is you really don't get any copays, or very little copays depending on which program you sign up for. They're relatively comprehensive by their very nature. Some of them really go and get extravagant and have workout facilities and all different kinds of things to keep seniors active and healthy. And they keep after them with counseling and all kinds of stuff. And to that extent, it works pretty well. The problem is not all Medicare Advantage plans are the same. And some of them downright stink. They offer horrible service. They have terrible outcomes. And these companies are getting paid a huge premium and not delivering a premium product. So bipartisan-wise, the government went back and said, Democrats and Republicans said, where can we save on this? Well, they decided a couple of years ago that they were going to put in place a program that monitored these Medicare Advantage programs through their own clients. And based on actuarial details and feedback from their own clients, they'll get a score every year. And if they don't meet a certain acceptable score, their premium in Medicare Advantage will be cut by the government all the way down to regular Medicare rates. So it's either you perform really well and you can get the full benefit of Medicare Advantage, or if you can't cut the mustard or you're just mediocre, you're going to get paid less. There will not be a premium for you. It doesn't mean they're cutting out Medicare Advantage. What they're doing is they're holding the insurance companies to task to make sure they're earning their premium. And many of them are not. As a matter of fact, most are not. There's very few that have a very good rating. Most have a very piss-poor rating. And they're all working overtime right now trying to burnish their reputation among their clients, because if they don't, they're going to get the hammer put down on them and they're not going to make any money. And then they're going to be seen dropping seniors. And that's going to be really ugly PR for them. So that's where this $716 billion is primarily coming from. The government paying extra to private insurance to provide the same thing Medicare does in a managed way, supposedly to lower costs and raise the quality of health care, which in a lot of ways they're failing to do, or they have for many years failed to do. Now some of them are getting serious and realizing that the piggy bank trough is going to run dry if they don't provide service. That's just the facts. Now, the other thing they're doing is they're cutting back on certain hospital payments because hospitals generally charge an enormous amount to Medicare in order to make up, and private insurance, in order to make up revenues from people that are not covered. And it's kind of handled in this way. Private insurance pays a big chunk of it, Medicare pays a big chunk of it, and Medicaid pays a big chunk for all those people that run into hospitals that have no insurance whatsoever. And part of the reason they're able to cut this money out of these hospitals under the Affordable Care Act, or what they call Obamacare, is because there will be more people covered and less people theoretically running into the hospital without any kind of insurance at all. Also, the insurance companies are okay with these Medicare Advantage cuts because Obamacare, which everybody thinks is this big government institution, once again is setting up private insurance companies, pools of private insurance for people to go to private doctors in their discretion, as long as it's in their program that they chose to buy. So the idea that it's this big government takeover of healthcare is absolutely, fundamentally incorrect. Now, the Republicans, when Obama takes the money, he's going to take some of it, the $716 billion, over 10 years, by the way. A lot of that money is going to fill the Medicare Part D donut hole, so that seniors don't get stuck paying that $3,000 between $2,000 and $5,000 all on their own for prescription medications, which is an immediate benefit to current seniors. The Republican plan does no such thing. It takes all the money away from Medicare Advantage and it just leaves it there. It just takes it away. It's one less expense. There is no increase in services. Under Obama's plan, there is an increase in services to seniors, real-time seniors today that are on Medicare, who will help cover the donut hole. And some of that money will also go in to helping cover the cost of covering more people by expanding Medicaid for those states that wish to expand Medicaid, and for those states that don't, no problem. The residents will vote and decide who stays in office and who keeps people from having health care and not. That's a whole state discussion, state by state. But on the federal level, every dollar that Obama saves goes into something productive to help more people. The Republicans take it out, that money, so they can help pay for tax increases for the wealthiest Americans. Their long-term goal is this: they want to take Medicare away and replace it with a private voucher system. Now, this is how this works. Right now, everyone gets guaranteed coverage under Medicare at some point in your life. Everyone. The new program works differently. It works kind of like Obamacare, actually. They're kind of Obamacare Medicare, if they can wrap your mind around this. Instead of covering you like one big, huge pool, what they do instead is they hand you a voucher. And a voucher has so much dollar amount. And they say, you go out and try to find health care coverage in the private sector with your voucher. Now, the one thing people seem to forget about government programs, they are all pegged to the rate of inflation. So if the regular rate of inflation goes up by 1% or even drops by 1% a year, your voucher you get every year will go up 1% or down 1% or sideways and do nothing. But our history with medical costs in this country have always far outstripped the rate of inflation. So every year, using current logic, within 5 or 10 years, your voucher is going to be useless. And the average person normally is on these programs about 20 years, give or take, actuarially. They're about 20 years now, give or take, maybe 15, but 20. So at minimum, it's going to cost, they estimate it's going to cost every human being, male and female, $6,300 and something a year more for your Medicare. That's before gap insurance and everything else. Now, over the course of 20 years, that's about $127 extra $1,000 that you'll need just to retire like somebody retiring last year. Now, they want to do that to everyone 54 and younger. For example, my age group, I'm in my mid-40s. I've spent 36 years, because I started putting into Social Security and Medicare part-time jobs at 10 years old, payroll deduction taxes. I put into the system for 36 years. Now, they want me at the end of my work life to suddenly come up with $127,000 more just to retire like somebody did today, even though I've spent my entire life paying into a system that promised me something. That's an important fact. Absolutely an important fact. Where are you going to come up with the money? What if you're disabled? They want to cut disability. So if they cut your disability payment and you're only making $12,000, and now they're going to cut your Medicare and they're going to give you a voucher, and it's going to cost you $6,000 more just for the voucher, what are you supposed to eat with and live on? Doesn't make any sense. That's important. And you've got to ask your politicians these questions. This is not a light subject. This is not for the meek. This is not for the mindless. And this is not an emotional topic. This is a real life, affects everyone conversation that everyone should be having, and everyone should be aware of what's going on. No one should be scared to retire. No one should be scared of becoming disabled. And ask your politicians on both sides of the aisle this question: what's going to happen to long-term care in Medicare? This is more important than any other thing as far as keeping costs down and keeping you safe in your retirement. Currently, under Medicare law, and they keep trying to cut it back, they have long-term care. That's where a nurse or a nurse's assistant or somebody comes in and they help you dress and they help you wash and they help you cook your meals and they drive you around and they do things that you can't do for yourself. And the test, or the litmus test they use for that, is very high. And you have to be reaffirmed every single year to say that you can't do these things. And they assign you, based on your ability to do things, they assign you only a certain amount of hours per week to do that. Now, many people for years have been saying, well, the answer is long-term care insurance. Now, how many of you have long-term care insurance? Did you know it existed? Do you know how expensive it is? It's really expensive, $700, $800 a month. So about 95% of America can't afford it even if they wanted to get it. And the kicker with long-term care insurance is this: no matter if you pay every month on time, it doesn't start for 5 years. So if you're paying in good faith for 3 years and you get in a car accident and you're disabled, you still have to pay for 2 more years before you can use it. And how many people can afford $800 a month on disability if you're only getting $1,000? So don't let any politician, right or left, take away long-term care in Medicare. And that's one of the things they're trying to fiddle with on both sides. So careful. Ask your politicians. Write them and ask them. Tell me what your position is on long-term care. Because in the long run, it's actually cheaper. The reason they came up with it was this. It's cheaper to have a nurse or a nurse's assistant come in at basically minimum wage, and then I think it's $1 or $2 an hour for the company that hires them or basically does the payroll for them to come into your house and help you. It's cheaper than going to a full-fledged nursing facility or a nursing home, a skilled nursing home. Skilled nursing homes are very, very expensive. So this was an alternative to help people stay in their house, have some freedom, have a little bit of self-respect, and not become a vegetable in a nursing home on Medicaid. And actually, it's actually less expensive to do it this way. And they're very good at enforcing these rules. So ask your politicians about them because they are important and they will help elderly with their dignity. And the other thing that you should be asking your politicians about with Medicare is this. What is their stance when it comes to end of life? Hospice care. Hospice should be covered under Medicare. Absolutely covered. Because many people choose not to want to suffer and go through horrible chemotherapies and drag on diseases for years and years and cost the government millions of dollars and cost themselves years of agony. They would just rather die in peace. And hospice allows you to die in peace and allows you to die comfortably in peace. In a holistic, whole way, spiritually, mentally, emotionally, and physically. It's very cost effective. And it's very effective for anyone that has stage 4 cancer or any kind of disease that you will never recover from. So don't let them cut hospice. Very, very important. Because you're going to need it, or you might want to need it, or maybe one of your family is going to need it. And for anybody that's been around hospice, it's invaluable. Long-term care and hospice, two of the most important things in Medicare that we can't afford to lose. It's worth keeping around in its current form, with the modifications of taking away the extra payment to private insurance for Medicare Advantage to those insurers who are not getting the outcomes and the service that they are supposed to provide for their premium. That's just business. Any free marketer should have no problem with that. There is a way out of this situation, but it's not to slash and burn the program, and it's not to overfund the program just for the sake of overfunding the program. It's to take rational steps to make the program work well, which it does, and make it work better, and pay for it. That's the important thing. That's all I have to say today on the subject. Please pay attention and ask your politicians on both sides of the aisle what they're going to do with your Medicare. Thanks for listening.